All right, it is 7 o'clock p.m. and this is the EmPower Hour. For everyone who is here, we thank you for being here. I just need to do a couple of things. Just give me a quick second here. A quick second and we'll be ready to get started. Okay. Okay. All right, again, I want to thank everyone for being here this evening. It is 7 o'clock p.m. and we have another edition of the EmPower Hour. We're dealing with coronavirus and what's known as novel coronavirus disease 19, or better known as COVID-19. And that's what we're going to be dealing with this evening. We are so grateful to have with us a one-on-one conversation. This is going to be a little different. Different in the sense that ordinarily we have a panel of guests that present to us, but tonight we're going to have a one-on-one session with Dr. Rueben Warren. So we're glad that he's been able to take time out of his busy schedule to join us. He is a preeminent scholar, to say the least, there at Tuskegee University. And some of you are familiar with his work. He's over the National Center for Bioethics in Healthcare, in Research in Healthcare at Tuskegee University. And so what we want to do is have a little bit of a background on sort of the Tuskegee legacy. And then once we deal with the Tuskegee legacy, we'll sort of move fast forward the tape to 2020 and deal with what we have going on currently. And hopefully you'll enjoy the format that we're going to have this evening. Again, Dr. Warren and I, we will have conversation for the next 15 to 20 minutes or so. The majority of it you'll be hearing from him. And then we will open the conversation up for everyone else. So we are glad that you're here this evening. And again, everybody's hope and pray everyone is safe, everyone is healthy, and that everyone is at home, in place, as they say. So again, it's great to see everyone. I see a lot of familiar faces. Thank you for being here. See a few of my graduate students that'll be joining us in a couple of weeks. And we're glad that they're here as well. Glad to see so many people here. And of course, we'll acknowledge you as we go throughout this afternoon and go throughout this evening. So again, just to get started, to put Tuskegee in some type of context, before I turn the floor over to Dr. Warren, I think we just need to take a moment and think about Tuskegee itself, the Tuskegee study. So if we could sort of go back in time, if you will, and talk about how the Tuskegee study came into being. And we have to go all the way back to the founding of Tuskegee University. Now, we attribute the founding of Tuskegee University to Booker T. Washington, and that is true. However, there were men right there in Tuskegee who had already organized a school, and they really called upon Booker T. Washington, who was at Hampton Institute, to come down and help sort of formulate that school. And that school became Tuskegee Institute. But there were men already there doing work, good work in community in Tuskegee from Tuskegee. And it's just that Booker T came and he founded Tuskegee Institute. But we always want to make sure that we acknowledge those men and those women who were already in Tuskegee doing good work. And Booker T, being educated, came and actually founded what we know to be Tuskegee Institute and was a leader extraordinaire, to say the least. And part of what Booker T did in his infinite wisdom as such a young man and such a great leader, he was able to reach out to different corporate philanthropists. If you ever go to Tuskegee's campus, obviously you'll see many of the names of the people that he reached out to on the buildings there at Tuskegee. There are some of the volunteers that we take a group of teenagers to New Orleans every summer. They're in the group with us. And every time when we go to New Orleans on the way back, we pay homage to Tuskegee. We'll stop at Tuskegee, we'll tour the campus, and the young people, the teenagers, the volunteers, they get a chance to see all of these buildings. One person in particular that Booker T. Washington, and I'll be brief, that Booker T. Washington was able to network with, as we call it in today's terms, was Julius Rosenwald of Sears, better known as JR. And it was with that partnership between Booker T. Washington and Julius Rosenwald, JR, that they started establishing the Rosenwald schools, right? There are many of us, especially elders who were, particularly in the South, that were educated at Rosenwald schools, right? One thing that I appreciated about the way Julius Rosenwald set things up, he made sure that it was a partnership, that he did not just donate money to these different communities, and a lot of YMCAs were founded as a result of Rosenwald money, but he made sure it was a partnership. As a matter of fact, as Rosenwald schools sprung out throughout the South, my grandfather donated land for a Rosenwald school in Aiken County. So I'm very familiar with the Rosenwald model. But Booker T. Washington died in 1915. And the Rosenwald schools continued. Stay with me. And Rosenwald continued to fund Tuskegee by being on the board and giving money to Tuskegee and giving money for the Rosenwald schools until his death in 1932. Now, 1932 is an interesting year. It's the year Rosenwald died, but it was around the same time that the United States Public Health Service, seeing all of the work that was going on in Tuskegee, just being public health officials, they just said, well, let's just try to look at the health of what was going on in Tuskegee and Macon County, Alabama. Follow this. They were just looking at the health status of black folks in Tuskegee. And they noticed something. You know where I'm going with this. They noticed that there was a proliferation, there was a high number, there was a high prevalence of syphilis among black men. And somebody had the idea, some scientists had the idea and said, well, you know, with all of this that we see here in Tuskegee with black men and syphilis, how about we study them? Ergo, the Tuskegee study of untreated syphilis in the adult Negro male. A study that continued until 1932, when it was finally brought to a halt. And because of what happened with Tuskegee, with the Tuskegee study, and this is where, you know, we bring it fast forward now, because of a lot of the information and a lot of the misinformation that has gone throughout the African American community, that has gone throughout medicine. Now, let's also put it in the proper context. We put it into context in the sense that that Tuskegee study on syphilis is empirical research. That study is the gold standard by which all other syphilis studies are based. Follow that. It is the gold standard. There was no study on syphilis before Tuskegee, and there was no study like Tuskegee. Not only did you look at these 423 black men throughout their whole life spectrum, but then also post-mortem, right? You even examined them after they died. So there were many bad ways of looking at what happened at Tuskegee, and the type of information that has gotten out to the public has really left us jaundiced, have left us upset with the way the medical establishment has treated black folks. So we're here, having dealt with Tuskegee and its legacy. And I will say that in 2006, I went to a meeting at the CDC, and I was invited by, you'll notice in the chat that I'm putting some information here. If I can just pull it right quick, just give me a second, please. I was invited to the CDC with a meeting of scientists who were part of the, I'm sorry, I'm just trying to get my, okay, yep, there we go. Just getting it together, folks. Okay. I was in a meeting at the CDC in 2006, where it was a reconvening of the scientists from the Tuskegee study, because it had been about 35 years since the ending of the Tuskegee study. And I was right there at the CDC and listening to these scientists who were still alive talking about what had happened with Tuskegee. And you could cut the tension in the room with a knife, because you had one group of scientists that talked about, again, as we talk about ethics tonight and bioethics, you had one group of scientists in that room who said that what happened with Tuskegee was without question unethical, and that should not have happened to anyone regardless of ethnicity. And you had another group of scientists in that room who said it was worth it. And if they had to do it all over again, they would. I was there. I heard and saw this with my own eyes. Well, anyway, that notwithstanding, I will say the person who invited me to that meeting at the CDC, the person who invited me to that meeting, I'm multitasking over here, you know, when you run it solo, is Dr. Bill Jenkins. It's just by sheer coincidence that Dr. Bill Jenkins, another Morehouse man, you see my Morehouse banner back here, Dr. Bill Jenkins, exactly 1 year ago today, there was a memorial service at Morehouse College, exactly 1 year ago today. And you'll see in the chat that I do have an article of his obituary in the New York Times, so I would encourage you to take a look at that. So 2007, thereabout, these scientists said that they would do it all over again. So let's fast forward to now. We're dealing with coronavirus, COVID-19. And we have this memory of Tuskegee. We have this tape playing in our heads with what happened with Tuskegee. And as people have reached out to me, I said, well, let me just go ahead and start bringing experts that I know to the fore, to the table. And so I am so grateful, so thankful to have Dr. Rueben Warren, who is over the Bioethics Center, as I mentioned, at Tuskegee University, the National Center for Bioethics in Research and Healthcare at Tuskegee University. So I am so grateful, I am thankful that when you're talking about anything dealing with Tuskegee study in this day and time, Dr. Rueben Warren is the foremost expert to talk about not just the past, but more than anything, how do we deal with the present and how do we move into the future as it pertains to ethics. So again, I am thankful that Dr. Warren has taken time out of his busy schedule to be with us this evening. I'm going to be quiet. Hopefully that was a nice little background on Tuskegee Institute, Tuskegee University, and the Tuskegee study. Dr. Warren, please, can you take the floor and just grace us with all of your knowledge, please?
Okay, well, thank you so much, Dr. Weaver. I think it's important to look back in order to move forward. And that looking back, you're absolutely correct. Booker T. Washington was brought to Tuskegee principally by a gentleman named Lewis Adams, a former enslaved man who actually negotiated with the white leadership, the political leadership, that if he would allow them to purchase some land, then they would then surrect Tuskegee Normal School, and they invited Booker T to join. That's the history, and it started off with a good intent, and you know, sometimes good intentions don't lead to good outcomes. Mm-hmm. And so I'm pleased to talk about the coronavirus pandemic in the context of the U.S. Public Health Service Syphilis study at Tuskegee. I'm intentional and not calling it the Tuskegee Syphilis study or the Tuskegee experiment, because that leads you to believe that it was Tuskegee as a principal parties, but it was in fact U.S. Public Health Service Syphilis study at Tuskegee. Mm-hmm. Moving forward, I think the important thing is we're in a very trying time with this corona pandemic crisis. And it's a crisis for the world. And whenever there's a crisis for the world, my lens is how does that impact upon Black people throughout the world? And I think this virus, this epidemic, this pandemic has allowed us to focus on a generic problem of both the health and health care of African Americans and others in this country. And what we're finding out now is that it in fact is really another layer of health disparity, of health injustice, of inequity. And if we don't focus on those populations at greatest risk, we will wind up repeating the mistakes of yesteryear. Now, I'm seeing something in front of me as a poll. And should I pause and allow the audience to fill out their poll?
Go right ahead. Go right ahead. They're listening.
Okay. So what the message that we're finding now is that what do we do in the midst of the unknown? And what I'm suggesting is that we have to revert back to principles of what I would call public health. And those principles of public health are embedded in a framework of ethics. I think if we don't understand that, we'll wind up repeating the mistakes of yesteryear. I'm honored to be at Tuskegee University and directing the Bioethics Center. What we focus on is the context in which those things that negatively impact upon our health and our well-being in the context of ethics. And ethics is simply the rightness or wrongness of events. And we also talk about ethics in the context of bioethics. And that's really focusing on the health and the healthcare delivery system and the research enterprise and how that is negotiated. And this coronavirus pandemic is really, I would argue, it's a public health ethics issue because it talks about how we relate to community, that engagement, and how do we begin to do things in the right way to impact upon that community, and most importantly, how do we do that in the context of social justice? When we find ourselves trying to resolve an issue that is at a great challenge to this country, and we tend to look to the science, and science has not evolved to the point when it tells us what to do. And what it does tell us is some things that we know to do, which are basically public health principles. And I would argue that those principles start with those things that impact upon the population. For example, they talk about hygiene, nothing new, but they're talking about washing your hands, nothing new, but that's grounded in public health principle. They also talk about the notion of social distancing and how that's unfolding as some very interesting dynamics, unfolding in terms of who can social distance and what does it really mean. The important part from my perspective, I heard president of Mass General Hospital a couple of weeks ago talk about the difference between social distancing and physical distancing. And I paused to try to understand that difference. And then just this morning, the dean of the School of Public Health at Yale said the same thing about social distancing and physical distancing. And that distinction is particularly important, I would argue, in the context of the Black experience. So we should be physically distant. That distancing is critically important. But the social distancing is, I think, dangerous because it tends to promote isolation. Mm-hmm. And isolation creates a whole set of other problems, both mental and social. So we need to distinguish between the two. So what do we do? And what I do, and I can show you what I do most importantly, whenever I'm outside, I put on this mask. And the science of that is even evolving. Start off with the N95, and then there was a shortage, theoretically. And now the latest is that you don't need the N95, what you need is some handmade, homemade covering. And while that science is also evolving, that's the best that we know. So I'm encouraging everyone to put on the mask and continue the physical distancing where possible. And I put that in the context of where possible. And I also argue that we have to watch the epidemiology evolving. And the latest that we're hearing is that the black population is disproportionately suffering, both in infection and in mortality. And key spots where the population percentage of African Americans is a certain number, 40%, 30% in Chicago, and the death rate is 70% in Detroit, and wherever we are in Louisiana. So we've got a real challenge before us, and I think we've got to pause, reflect on principles of public health, and move forward. And that's kind of the opening context from which I hope that we can engage in some open dialogue around this tremendously important issue.
And Dr. Warren, I do want to revisit, of course, you and I, we had an opportunity to speak before now, and how do you think, when you talk about the United States Public Health Service, when you talk about the CDC, you talk about NIH, how do you think the government, federal authorities, if you will, what do you think their role should be in this, and how do you think that's being handled at present?
The role of the federal government, the state government, and the local government is to promote and protect the health of the nation. The authority of the health of an individual state resides in the health department of that state. So there's a relationship between federal, state, and local, but fundamentally, you are unable to get the right information out if you're not trusting the messenger. I think the challenge we have before us right now is there's some confusing messages at the federal, state, and local level, and therefore we're looking for, I think, an opportunity for leadership that is trustworthy. And I would argue that the most trusted leadership for the African American community surely is the African American health professional.
Yeah. Wow, that's a powerful statement just then. We have one of our leaders that said, when America catches a cold, we catch the fever. And I would like to say that we're finding that playing out, in this day and in this period, with how, as you mentioned, the disparities are in the morbidity and the mortality with people of color, particularly with black folks, given coronavirus. So what we want to do is, I promised that we would open up the floor for questions. If you could, for everybody who's in attendance, if you could in the chat, just put where you are, just put your city or state where you are. We'd appreciate that. We want to have some idea of the participants and where they are throughout the United States. So if you could in the chat area, please put where you are. If you want to be on the email list, you can email me privately. You can chat with me privately and just put your email. But again, we definitely want to know exactly where everyone is. Put city and state, please. That would help all of us as we see where you're from. Now, with that, again, Dr. Warren has really laid the foundation for where this conversation is going to take place. And one of the first people to comment, and we're going to let Henry Goodgame, who's over Alumni Affairs at Morehouse College, we're going to let him speak. And then he had a question that he wants to bring to the floor. So, Brother Goodgame, please, if you don't mind.
Thank you, Brother Weaver. Good evening, everyone, and thank you, Doctor, for your excellent portrayal of the conditions that we find ourselves in. I'm Vice President for External Affairs at Morehouse, and one of the things that we are doing is creating a series and finding out where our graduates are, what they're doing, and what topics they're covering, and making a series of that. That's why we've included that in our list tonight. One question I had, I was particularly troubling to me is, how is it that we were so misguided at the early stages of this not being something that was really impact our community, only to find out now that we're the most vulnerable of communities, from mortality as well as morbidity rates. Just what happened in that scheme for them not to all take the right factors in, and now we find ourselves once again running behind something and trying to avert ourselves as a community. Wrong advice to our community, all night long.
Well, from my perspective, the misinformation was throughout the country. It was not necessarily directed to the black community, but we were just misinformed, and I, as a result of that, the distrust was mounting. So I think with the lack of information, we were able to then what I would argue the conspiracy theories began to mount, and that doesn't mean they weren't true, but it created a sense of unknowing, and out of that not knowing, then the panic and the disarray occurred. So yes, we were not informed correctly, but I don't think the nation was informed correctly either. Thank you.
Well, we're opening the floor for anyone who has questions. You should see a wave icon there in the chat area. But we'll go ahead and ask questions again. You can either type the questions in, or you can just ask, directly if you want to be acknowledged. We have another question. Dr. Warren says, well, what is the best way to reach out via social media to spread the correct information about COVID-19 to the Black community? Any ideas on that?
The first and foremost is be sure you have the trusted source from which you're getting the information. And I think we've got a foundation within the Black community, and that's historically Black colleges and universities. Now, I'm not suggesting that they are the only ones, but those are the most trusted ones. So I would suggest that we reach out not to find out the correct information, the information that is most recent and most reliable. So I would argue that we should reach out to institutions that have historically given us correct and valid information, particularly in the context of our own experience. And we've got 4 medical schools in this country. We've got Meharry Medical College, we've got Morehouse School of Medicine, we've got Harvard University School of Medicine, and we got Broome University. So we got enough technical expertise to get the correct information.
And Dr. Warren, what is the responsibility of that Black practitioner, of the African American practitioner, of that healthcare professional? What is their responsibility to their patient?
To be informed with the correct information, and that is that network that we have. We've got the National Medical Association, the National Dental Association, the Association of Black Nurses, and on and on and on. So we've got the institutions and the organizations to begin to share the information, and I think we should reach out and hold them accountable, and I think they have been over the years.
Mm-hmm. Mm-hmm. Okay. Right, I'm looking for another hand. Is there another person who would like to have a question for us? I'm looking for hands. I'm looking for the icon symbol. Okay, well, I'll ask another question then. We talked about the research versus the implementation, Dr. Warren. What good is research? What good is research, right? If we don't have those parties that could take that research into community, and for that research to be used effectively and efficiently, what's the good of having that research?
Research is fundamental to moving forward in science, so we've got to have the research. But I would argue the research is important, but equally as important the researcher and the question, because research really comes from the insight, the expertise, and the interest of investigators. One would argue that research is supposed to be purely objective, and I would suggest that it is at some level, but at a more fundamental level, it starts with the question. And the question that researchers raise are subjective. Researchers investigate things of their interest, and therefore that starts the research enterprise. So we've got to get the correct information. Mm-hmm. So, particularly around research related to the African American experience. Mm-hmm. So research is critical. The translation of that research is equally as important. So that's where there's an interface between biomedical research and public health research. The developing of new knowledge and translating that knowledge in ways that can be used by community.
And Dr. Warren, why have we been taken advantage of so badly in this country?
Where do you want me to start? 1619?
You go back to 1555 if you want.
Yeah, and I think that the issue is vulnerability. And I think from the onset, we are one of the few populations that did not come here voluntarily. We came here under a certain oppression, and that oppression continues. So it is, I think, our obligation to begin to explore those things and resolve those issues that started with enslavement. The issue for me, the issue of enslavement has not been fully answered. Until it's answered, we find ourselves in the dilemma over and over again.
Okay, see, we have a question from a C. Jordan. I have unmute your microphone. You want to go ahead and ask the question?
I didn't have a question.
Oh, you did not?
No, sir.
Okay, that's fine, that's fine. I see that there's another question from Sakira. Sakira, give me, if I can find her here. Okay, Sakira. Okay, Sakira.
I put my question in chat. So I've been seeing online a lot of, well, first, hi, good evening, thank you for this. There are some conspiracy theorists out there that are spreading a lot of misinformation, saying things like, there is no such thing